All right, welcome to the Fix It video series. So I'm here with Kara Ramsey with Rooted Physical Therapy and Wellness. So, and in this series, if you've watched any of the others, you'll know that I'm going to talk to real people with real stories who really fix real people with real issues, which is a shot taken at the reality that health insurance is not health care. So I'm gonna ask Kara some questions. So here we go. So Kara, do you want to introduce yourself briefly, and then we can get going? So,
yeah, I'm Kara Ramsey. I own Rooted Therapy and Wellness, and I'm excited to be here.
Yep, cool. Thank you. So Kara, what do you fix? How do you fix it? And why should people trust you to fix it?
Yeah. So I am a pelvic floor physical therapist, and I specialize in a fertility treatment called Mercier therapy. So I fix a couple different things. I fix the issue of infertility through the Mercier therapy, and then I also help women with pelvic floor issues, incontinence, prolapse, low back pain, pain with intercourse, things like that.
Yeah. So tell me about Mercier therapy, because I know nothing. So
So Mercier therapy, it's a holistic fertility treatment. It is a therapy based in manual therapy, so it's all passive for the patient. It's all external, deep pelvic organ visceral mobilization.
So nothing internal.
Nothing internal. So I know that some people get scared away from that we're mobilizing their uterus and ovaries internally, but it's all external.
Yeah. Okay. I wondered. Yeah. Okay. All right. So all external.
Yep.
So, and what's the basis, what's the driver behind why it's effective for people?
So there's a few reasons. It improves blood flow to the area, which blood flow brings healing, right? Mm-hmm. Okay, so so that's one way. It improves mobility of the uterus and the ovaries. So specifically for my clients with endometriosis, PCOS, that have a lot of adhesions.
PCOS?
Mm-hmm.
Help me out.
Yep, polycystic ovarian syndrome.
Okay, got it.
Yep.
Thank you. Yeah.
Those diseases create a lot of inflammation in the pelvis, and inflammation isn't good anywhere and creates adhesion. So we work through those to soften those and to improve the mobility in the pelvis. And then probably the most important way that it works is it works on the HPO axis, so the hypothalamus pituitary ovarian axis, so the way the brain communicates with the ovaries. And so by stimulating the ovaries, we get the signaling and the hormonal signals going better and communicating. So it's pretty effective in achieving pregnancy, and then just for feeling better in the pelvis. If you've had a C-section, improves scar mobility there, just a whole bunch of things.
Okay, got it. Yeah. So, I'm really curious now. I'm diverging from the question. So,
Go for it.
When you're working with anything hormonal, you're on a timeline now for it to actually be effective. So it's not like I always use a hose to go clean out the cracks in the sidewalk. Like that's satisfying because it's instant.
Yes.
So that's not going to be instant then. So what's the general timeline someone would expect to see or not see an effect? Yeah.
So the protocol for the Mercier therapy is 6 1-hour sessions, and we ideally are doing them once a week. So usually by the second to third session, people are feeling better. And so for my women with PCOS or just kind of different cycles, they're starting to see improvements in their cycles and improvements in their symptoms by that second to third session. So we work all the way through the 6 sessions to finish the protocol, but usually it just takes a couple to feel better.
Okay. Do you mind, pun unintended, but fleshing that out for me? So what, in 2 to 3 sessions, that's not a normal, cycle, right? It's not a month's time. So what's the
so, depending on where they're starting their cycle, where they're starting their session, with my patients with PCOS, they're noticing that their cycles are less painful, that they're not having that ovulation pain, that they're getting their cycles to be shorter. So instead of 50, 60-day long cycles, getting to be 30 to 40-day long cycles.
They're my cycle started.
Yes, I didn't have pain leading up to it, or I didn't have a headache or things like that. So and then just kind of the PMS symptoms or the other symptoms, maybe the fatigue or facial hair or something like that are improved.
Got it. Okay. Wow, thank you.
Yeah,
I had no
you're
idea.
welcome.
That's
Yeah.
great. Okay, yeah. What else would you want to share about any of that? So, or anything
Yeah.
else not Mercier related? So,
Yeah. Just last note on Mercier, it's really effective in achieving pregnancy. It's 86% effective, whereas like the IVF and IUI rates, so intrauterine insemination and in vitro fertilization are closer to 25 to 30% effective in achieving pregnancy the first time. So
Okay. Yeah.
it's highly effective and a fraction of the cost. So
Right. Okay. Yeah. Okay. So with erectile dysfunction with men, I'll use you can water the ground more.
yeah.
So, but that doesn't actually change the ground. So, same analogy. The Mercier therapy is actually changing the tissue's
Yes.
ability to
Correct.
respond to whatever else is going on. So,
Yes,
okay.
correct. Yeah, and so if we use the Mercier therapy in combination with those
Yeah.
IUI or IVF, if we're preparing the soil better, then you're going to have better plants, better fruit.
Yeah.
So,
Yep. Okay. Yeah.
Yeah.
Babies. So, yeah.
Yes.
So, okay.
Yeah.
Yeah. Okay.
Yeah.
Yeah.
So then I guess on top of it,
Yeah,
my whole goal with Rooted is to kind of treat the mother all the way through her cycle of motherhood. So help her become a mother, help her through pregnancy, and then help her postpartum. So, so what I can do there is help pregnant women with symphysis pubis dysfunction, low back pain, incontinence, anything like that. And then postpartum, kind of the same things as just helping heal your core, helping get back to just normal function after the strains of pregnancy and labor.
Okay. Yeah, that's
Yeah.
great. So, okay, tell me about the 86%. Is that like 86% of the time it works every time, or what's the stats can be manipulated right certain ways? So tell me more.
Yeah,
what does that mean?
I am not a statistician, so I am not. I am not positive, but
Good.
So the 86.
She's a real person who can really help people.
Yes.
Yeah. There you go. Sorry, no slight to statisticians.
Yeah.
Well, a little comment. That's fine. Yeah.
Yeah. So the 86% is with the Mercier therapy alone and in combination with the IUI or IVF. So it's all together within a year that it's 86% effective in achieving pregnancy. So most of those were achieving pregnancy with the Mercier therapy alone, and then maybe 15 to 20% in combination with the other reproductive technologies.
I see. Okay, yeah. So it became like a 1 in 5 chance over a year's time.
Correct.
And it way increased it. Okay, that's incredible. So,
Yeah.
Okay.
Yeah.
Wow. Okay.
Yeah.
Okay. Okay. What else? Anything else? Oh, yeah, I guess, everything you just shared is reason for people to trust you to do this, Kara.
Yeah.
So, but anything else you want to add to, why should people trust you?
So why should people trust me? I'm just really passionate about this. I've had my own fertility struggles, so I'm doing this work on myself. I also aim to really educate women in fertility besides just the manual therapy, but kind of just a more holistic approach of what to eat, how to improve sperm quality naturally, how to improve egg quality naturally. And this is stuff that I'm doing for myself to improve my own fertility. So I can relate to women who've had losses and who struggle with their fertility in that way, more than just a normal practitioner. So I hope you can trust me.
Yeah, of course. Yeah. Very, very knowledgeable and good expertise. And you're seeing results already with other patients. So, So as your Instagram would show.
Yes.
So, that's good. Well, thank you for coming to the Fix It video series.
Yeah,
and,
thank you. Thanks for
reach
having
out if you have any questions. Remember, it's real people that fix other real people with real problems. Guaranteed health insurance is not guaranteed health care. So
That's right.
Thank you.
Thank you.